All right. So here is an overview of the week. Today we'll probably get through MRI and ultrasound. We may dip our toe into injury pathology. Wednesday, going over injury pathology and our emergency action plan assignment. And then Friday we have a guest speaker coming in via Zoom who's going to talk about emergency action plans. No, that's Dr. Samantha Scarno-Miller. She is a full professor at the University of West Virginia. She's later. She's late September, beginning of October. She cool human and knows a lot about emergency action plans. Any questions about this week? All right. Magnetic resonance imaging, or MRI. MRIs compared to other imaging modalities provide typically a higher resolution, higher fidelity, but as we will talk about, there are some challenges with using MRI for diagnostic imaging. So what have you seen MRIs used for? Kayla? Spine injuries, all right. Put this down. Ava?
I have a question.
Yes.
MRIs are the big machines that you get, like, do they still have, like, the beeping thing where it's like, hold your breath for this amount of seconds?
I have no idea.
Have you ever been in an MRI before?
Yes.
What was it like?
Fine.
Do people who are
You stay-
claustrophobic have to get knocked out or go to a different machine?
Sometimes. Spine
I don't know if you can.
spine injuries.
Earbuds? No,
Brain injuries, all right.
I do like
Brains.
hold your breath for this, but I think it was just to keep you awake.
Paige got us with brains. What else have we seen MRIs used for?
Can I do it on your abdomen?
Sure, you can do it on abdomen. What else can we use them for? Josie, then Lainey. Tumors. Lainey? Muscle injuries. Good. Anyone else?
What can't they be used for?
It's a great question that we will answer shortly.
Okay.
Yes. Howdy, Cather, Katie, Alexis here, Sam is here, Annie is here, Kayla's here, Josie's here, Bennett is here, Lainey's here, Tolu's here, Jake is not here, Paige is here, Kayla, Audrey, Kayla, All right. So when we talk about MRIs, all of those can be used. We can use an MRI for all sorts of different injuries. We're not limited by kind of what or where we use an MRI, but there's some different physics that allow us to get a higher fidelity image from an MRI as compared to a CT scan or an X-ray. When a patient is in an MRI, we rely on magnetizing the patient, placing them in the center of an electromagnet. So you can see this patient right here is in the middle of this big old giant magnet. And we will have an electromagnet, we will have a detector, radio transmitter, and scanner as all part of the MRI. The human body is weakly magnetic, and the degree of magnetization or ionization is much smaller than iron or steel, so we're able to essentially magnetize you without having you be like attracted to the magnet. It's part of the reason why you can't have any metal on you or in you when you get an MRI, because the magnet is so strong, it will literally rip a pacemaker out of you. And so in patients with have had surgical screws or surgical plates put in, or hip replacements or shoulder replacements where they have hardware that is metal, they cannot get MRI scans. They have to get CT scans. Yes, Caleb?
If you were to like swallow like a nail or
Mm-hmm.
something and then go on an MRI, would it just like,
Yeah, it would be very painful.
it would just rip out of your...
Yep. So the way that we detect the image or the change in energy is through a radio transmitter coil, and the advantage of the MRI is that it doesn't have any ionizing radiation, so we're not putting a patient through, we're not giving them x-rays as compared to a CT or an x-ray, where this is much less harmless, but they're bigger. They oftentimes require more considerations, more expensive, slower. We'll get into more of that later. So, did you all go over magnets in physics? Some of you? Not really? All right. So, you're going to get a poor man's explanation of electromagnets. Bear with me. So, we have magnetic fields around the patient, and we create north and south poles when we apply that current. And so then what happens is when we have patients in the MRI, the hydrogen atoms in your body will all orient to the same direction. And so then what we are able to do is then when we apply a current, we can see the change in the direction of these ions, and we can kind of detect them in a way that helps us to see, get that grayscale image. So we apply a current, they all orient to where we magnetize, they all orient in the same way. We apply a current and we are able to see the change and develop an image. It's kind of basic what we're getting to. And so if we look even more basic at maybe even a wire, we can alternate we can produce a radio wave by alternating the current and using a high frequency alternating current. The magnetic field around the wire carrying the alternating current changes direction every half cycle, and the resulting disturbance or the resulting radio wave is transmitted outwards at the speed of light. The wavelength is the distance between those two peaks, and MRI systems use transmission coils to produce radio waves rather than the simple dipole wave shown here. So when a patient is not inside an MRI, the amount of magnetization is negligible. and when we put a patient into this strong magnetic field, they all align with the body right into those north and south poles. And then we deliberately try to disturb it, and it allows us to use that disturbance and that change to generate that image. So as we're passing through a wave right here through this patient, we induce a voltage, and so then once we induce that voltage, we get some nice lines, we get to the disturbance that we can detect. And then we can also kind of, depending upon how fast the wave dies out, we can also determine the density of the structures, and so that's partially what allows us to get that grayscale image as well. So a handful of advantages to MRI. There's a good degree of soft tissue contrast. Like CT scans, we can generate images in any plane, and there is no ionizing radiation. Disadvantages were limited in our ability, or availability, So not every urgent care is going to have an MRI, but almost every urgent care will have an X-ray because they're a lot cheaper and a lot easier to use. They're expensive compared to an X-ray where we're looking at like 80 to a couple $100. MRIs are going to be in the several hundred to several $1,000s, depending on what we're doing and what we're scanning. We can't use them with implanted medical devices, so think of someone with screws or a surgical plate inserted, or like a hip reconstruction, a shoulder reconstruction. It takes a long time to obtain those images, and in claustrophobic patients, they may find it difficult. So someone with diagnosed claustrophobia. What MRI is really good for, so that soft tissue pathology, so a ligament, cartilage injury, and we can also use it for surgical planning like CT scans. So let's say we wanted to see someone move and see the structures move. MRI is not good for that at all. It takes a long time to get those images, and part of that is we need patients to stay really still. So compared to ultrasound, where I can put a probe on a patient and have them move throughout their range of motion, and I can see what that structure is doing. MRI, we can't do that. Like I said, rapid evaluation takes a really long time. MRIs take about 45 minutes to an hour to do. CTs are on that 15 to 30 minutes. X-rays are in that 5 to 10 minute range. So if you need an image really fast compared to CT, you're going to get a lot faster results rather than an MRI. It takes a long time to do. Injections. As you can imagine, you would have to have a needle inserted into a patient, and so if we're trying to do an injection with an MRI, that MRI is going to pull that needle out of the patient, so we can't use the MRI there. Compared to, say, an X-ray or a CT scan, while we're doing an injection, X-ray or CT are going to be a little bit more applicable, a little bit more available to use. And that's kind of the brief summary of MRI. Any questions on MRI? I'm not really going to have you look at MRI images. It's kind of difficult to wrap your head around sometimes. All right. I'll pause here and I will get ultrasound imaging out. And then we will look at some ultrasound images. Oh, come on. Hello? Where is my... Yep, I just did. There it is. There's my mouse. All right. All right. So, ultrasound imaging. Ultrasound imaging relies on sound waves as compared to MRI, where we're looking at magnetic and frequency of radio waves, or even X-rays when we're looking at X-ray or CT. We can generate sound, and sound is on a wide spectrum. So the range of our human hearing is anywhere from 20 to 20,000 hertz, and everything above that is going to be ultrasound. When we think about sound in, say, a speaker, we apply a voltage and we change that voltage to induce a speaker to move air at a frequency, and then that generates sound. We can do the same thing to a crystal. It's called a piezoelectric crystal. So what we do is we apply a voltage, and that voltage it will physically deform the crystal at a rapid rate, and that will generate sound. The sound will only move in one direction or in one dimension, and so we can take advantage of the sound waves in order to generate an image. The other thing with ultrasound is when we are imaging, the crystal can also not only act as a sound generator, but it can also act as a receiver. So when those waves are reflected off of structures and they bounce back to the transmission probe or back to the ultrasound probe, it will allow us to interpret the strength of those sound waves into different densities and different levels of grayscale on our screen, and we will be able to somewhat identify structures. Of all the imaging techniques we have talked about so far, ultrasound is probably the most user difficult to understand and to grasp, but is typically the cheapest method. So typically when you are trying to image something, we need to take into consideration the wavelength and the frequency. And so what we have to do is look at what frequency. You might have a probe that has just one frequency, and there are some probes, the probes that we will be using in class have an ability to generate multiple frequencies. And so we have our 2 megahertz wave. We're going to use that for a lot deeper structures. Our 5 megahertz wave is going to be a lot soft tissue and fat. And then our 10 megahertz wave, the higher frequency waves, are going to penetrate a lot shallower. So if you're looking at, say, blood vessels on the skull, so just in that superficial skin layer, we would want to use a very high frequency wave compared to if you want to image, the quadriceps muscles, and we're trying to look all the way down into the bone. We're going to select a frequency that's a little bit lower. So, in order for us to scan, not only do we need a patient, not only do we need a probe, but we also need ultrasound gel. And the reason why we need gel is that sound doesn't travel super well through air, especially when we get into a lot higher frequency. Those waves are not going to travel very well through air, and so we need a medium in order to pass the waves through from the probe and through this patient's skin. Ultrasound gel is mainly water, and so typically patients don't have any sort of allergic reaction to that. You can also use, they make essentially just pads of ultrasound. They're a little bit more dense, and you just place the probe on, but it's a little bit more difficult for you to move around with just that little gel pad on. Compared to X-rays and CT scans, ultrasound is safe, and it is considered safe for prenatal scans, since it's non-ionizing, and so that's why we use it a lot for pregnant patients, or patients who are pregnant. And also, one of the advantages of ultrasound is that we're able to take a dynamic image. So a handful of terms that you need to understand when we're talking about ultrasound images, when you are examining some of these images, is some basic terminology. Hyperechoic, so hyper being brighter. Hypoechoic is going to be darker, so if we're talking about hyper and hypoechoic structures, they're compared to one another, and so one is brighter or darker than the other. We have anechoic, no sound. So in this image, this is an image of someone's bicep tendon running through the intertubercular groove on their humerus. And so we will see the hyperechoic reflection of the bone right here. And we can also see a isoechoic shadow behind that bone. Ultrasound cannot penetrate through bone, so we will only be able to see structures that are superficial to bone. You can detect fractures on ultrasound, but it is typically a little bit harder to do. And then isoechoic, same color as the neighboring tissue. And so we can see here the biceps tendon running through that intertubercular groove is isoechoic with the tissue around it. Everyone get a good grasp of these terms here. All right. So when we are doing ultrasound, the other thing that we have to consider is how deep we want to, how deep we are going to focus our image, and how deep are we going to send those waves. And so you could, if you wanted to, you would probably get a really terrible image, but you could take a probe that is meant to generate 20 megahertz and try to image a quadricep. You'll get really good definition through the first centimeter or two, but after that, it will look like dog shit. So we have to select our correct probe, or we have to select in the probes that can generate multiple frequencies, we have to generate the correct setting. And so that will allow us to kind of auto-generate a good depth that we can have our image at, and in the probes that we will be using, we can adjust the depth on our device. All right. Handful of advantages. Ultrasound is portable, typically relatively inexpensive. We can do dynamic images, and we can deliver it at the point of care. So there are a number of ultrasound imagers out there that essentially fit in your pocket, and we will be using those. They are relatively inexpensive. So a typical x-ray machine is in the, we're starting at the like $20,000 to $30,000 range. A typical CT scan is going to be in the about 100-ish thousand range, and typical MRIs are in the millions. And depending on the number or strength or intensity of MRI, so what is it? I think the University of Minnesota has one of the world's strongest MRIs, and I think it's like it's either like 20 or 30 Tesla MRIs. Your typical MRI that you'll get imaged in is like anywhere from a 1 to a 3 Tesla MRI. I think the MRI at the University of Minnesota weighs as much as a 747. It's like 500,000 tons. They had to build its own building for it. Yeah, so as we get higher in energy, we get higher resolution, and we're able to get more energy through that patient's body, but it also gets a lot more expensive. And so typically the highest Tesla you'll see in hospitals is around a 3, maybe a 5 if they're a really big research institution. But ultrasound, even some of the higher end models of ultrasound are in the like 15 to 20,000 range. And then the probes that we will be using are in the like $3,000 range. So relatively accessible for many more different types of providers, so much so that in some cases hospital systems or medical universities issue every single one of their medical students a point-of-care ultrasound unit. Disadvantages, we can't obtain deep structure images very well, we can't penetrate bone, and we need some pretty extensive documentation and knowledge of anatomy and bony landmarks in order to really interpret the image very well. When we do ultrasound imaging here in class, we will kind of go over them, and it will be a little bit easier as myself and Ms. Noble will guide you through the interpretation of the image. Well, ultrasound is really good for tendons, ligaments, muscle injuries, injections. A lot of physicians now are using ultrasound-guided injections in order to make sure that they're delivering drugs at the site of injury, specific to where the patient is having pain, or let's say we're trying to drain a cyst. It will be really helpful if we can see exactly where the needle is and where the cyst is so that we can properly drain it and we're not damaging any unnecessary structures. And then once again, ultrasound, not useful, deep structures, so like inside organs as well, inside bone. Any questions on ultrasound? All right. Now what I'm gonna show you all is some cases. So why don't we take 5 minutes and we'll come back and we'll look at some images.